my partner. And great. Well, welcome everyone. Thanks so much for joining us today. You are in for a treat. We have a wonderful program in store for you. So again, welcome. My name is Rachel Bonsignor. I'm the director of Liftoff of Western New York. And this is the second part of our three-part summer learning series. And today we are featuring one of Liftoff's priorities and partnerships. We are focused on early developmental screening and our wonderful partners at Help Me Grow Western New York. For those of you who might be new to Liftoff, we are an aligned action and learning network of funders and leaders from across Western New York who are really working to ensure that the 100,000 young children in our region are off to the best possible start. Our priorities include developmental screenings and connections to timely services and supports, making sure that young children have affordable, accessible, and available high-quality childcare. And we are also focused on transportation because all young children, regardless of where they live, should have access to services and supports when they need them. We are really in for a treat today because this is especially great because Liftoff is a leadership partner of Help Me Grow Western New York. And we have some great shared priorities, and Liftoff benefits from the incredible data savvy and analytics from CCNY and the Help Me Grow team to inform our action and our advocacy. And so really grateful to have Emily Oakes joining us as our featured presenter today. Emily is the lead data strategist for CCNY Inc. in their early childhood department. Emily has over a decade of experience in the nonprofit sector and providing direct service to clients, as well as developing and implementing complex programs with the community and partners to achieve optimal results. So before I turn it over to Emily, I just want to ensure and let you know that we are recording today's session and will provide copies of the materials to you by email afterwards. And we also link this presentation on our website so you can revisit it anytime that you like. And I know that Emily is encouraging us to make sure that this is an interactive session. So you're welcome to drop questions in the chat or raise your hand at any time. And I'll keep an eye on the chat and monitor to make sure that we can pause and have some great conversation. Because it's summertime, this is a little less formal, and we want to make sure that we have some great conversation and discussion today. And you're also welcome to enjoy lunch and come and go as you please. So with that, I will welcome Emily and get us started. So Emily, thanks so much for being here and sharing your awesomeness with this fantastic group of people.
Thank you. Thanks so much for having me. And thank you all for attending during this sacred hour that I like to call lunch. So I really appreciate you being here because your time is so valuable and you are all doing, I see the organizations that are here in the chat, you're all doing incredible work. So the fact that you would take an hour to spend it with me and Liftoff, I'm just really grateful for. So thanks for that. I did just want to start out by asking folks, like, if you look at the bottom of your screen, there is a little button that has a smiley face with a plus sign that says reactions. If you click on that, there's 3 dots that gives you a wide array of emojis. So I was just wondering if folks would be willing to put an emoji up for how they feel about working with data or reading data in their day-to-day work. And there's no judgment here, judgment-free zone completely for how you feel about it. Just kind of want to get a sense of the temperature of the room. Nice. All right. We got some thumbs up. We got some wow. All right. Lovely. Lovely. Oh my gosh, y'all are my people. This is great. This is great. And if like it's not totally your thing, that's totally fine. That's great because this session is for everybody. So I definitely have days where I'm more of like the single sweat emoji and then other days where I'm more of a thumbs up emoji. So so thank you again for being willing to share that. So as Rachel mentioned, if at any point in time you have questions, you're welcome to put it in the chat, or if you'd like to unmute and just ask the question. Some of our session today will be actually going through our dashboard where I'll be clicking on things and changing filters. And sometimes it can be hard to like keep a question in your mind that might relate to a specific variable or filter. So feel free, unmute and let your question flag fly. So thanks again for being here, and we'll go ahead and jump right in. So I'll share my screen. All right, can I get a thumbs up for the slides?
You
We're
look
good?
good.
All right, excellent. Thanks, y'all. Okay, so again, my name is Emily Oakes. I'm the lead data strategist here at CCNY Inc. CCNY is based in Buffalo, New York. We're an eval and analytics company. However, we also have an early childhood department that is focused on systems building work. So we're doing that mostly through the Help Me Grow model. Help Me Grow is a national model that's being used across 37 states. And the crux of the Help Me Grow model is that really maximizing our community's potential starts with early childhood systems, so that our education, healthcare, and family services, all those systems that promote children's optimal healthy development are key for a well-functioning and healthy society. Help Me Grow Western New York is an 8-county network. And we use the Help Me Grow model to advance awareness of the importance of early life experiences. We do this through free training about developmental milestones, as well as using early childhood screenings like the Ages and Stages questionnaires, and also communicating directly to the public through social media and Bright by Text. We also provide free universal access to developmental screening. So on our website that I'll show you a little bit later on, there are links that folks can use to complete social emotional screenings or developmental screenings for their children for free. We also partner with organizations who are already working with families and children in an effective manner to implement early childhood screenings into their day-to-day work, as well as the follow-up pieces that if a child's indicated for any monitoring or intervention, that they have access to the services that they need. Another big part of Help Me Grow is improving linkage. So for families who might be in need of early childhood services, we have a helpline, which is the centralized access point. The number for that is 716-760-GROW. So that's a helpline that's available to families throughout the 8 counties of Western New York that caregivers can call if they have questions about developmental services or to have their child screened as well. We also want to use the data that we collect as Help Me Grow to inform advocacy and policy efforts in the region, and then also work with other organizations such as yourselves who are doing incredible work to make sure that the data that we have supports the work that you do, and also to ensure that our system is working well together and that everybody is funded to the rate that they need to be. And we use data for things like that. So I'll go into a little bit more detail of how data will play a role in that later on. So for our outline today, I'm just going to talk a little bit about why we're collecting this data, what we collect, who can utilize it in order to take action with this data, and also how to actually use a dashboard. So again, if y'all don't mind finding like those little emoji buttons that you had before, do you use a dashboard in your day-to-day work as it is? If you wouldn't mind throwing like a little thumbs up emoji in the meantime to let me know if you are familiar with using a dashboard, or you use it from time to time, or have seen some of these before. Okay, seeing a couple thumbs up, great. So just a quick intro for a dashboard in general. A data dashboard is similar to a vehicle dashboard in the sense that we have these series of numbers and gauges and kind of warning lights sometimes that tell us when we may or may not need to take action. So for example, if you're in a vehicle and you look at the speedometer, speed limit's 45 and you're going 45, that's an indicator to you that you're coasting, things are going well, and you have you're doing what you need to do, right? If that speed starts to go up or down, we have a sense that maybe something needs to change. And so with a data dashboard, it's very similar. So we have certain graphs, certain charts that would show us maybe at some point in time, like if we're reaching our goals and things are going well, we can kind of continue to keep doing what we're doing to see the change that we want to see. However, if we have graphs and charts that are showing us that maybe we're not reaching the goals that we want to reach, maybe we need to put our foot on the gas a little bit more and make some changes to either our services, programming, or start to really delve deeper into why we're seeing some of the numbers that we might see. So why data? So the Help Me Grow model is kind of composed of four main pillars, and that little blue cog that you see in the corner of data collection and analysis is one of those main pillars. We use it to really support the evaluation of our early childhood system, and also we can use this data to identify gaps, bolster our advocacy efforts, and guide quality improvement. And that is our hope in the future. Right now, the data that we have, I'll kind of show you the types of questions that can be answered with the data that we have, and also where we'd like to go with some of this data in the future. So what data do we currently have? So as I mentioned, we do have a helpline called the Centralized Access Point. So that is CAP data. So we have information about linkage rates to different services throughout Western New York, as well as what services are most requested and what services folks who use our centralized access point say, what barriers are in their way in order to that prevent their access to those types of services. Right now, this data is internal. We're hoping to publish this actually within the next week or two on our data dashboard that the public has access to, so that folks can see for their own maybe grant application purposes and things like that, what services have been most requested in the region and what barriers might be in the way of folks accessing those services. We also collect data on ages and stages questionnaire results. So sorry for the consistent emojis, but I think it's actually a really helpful way for me to get a sense of familiarity in the room. If you wouldn't mind throwing a thumbs up if you're familiar with ages and stages questionnaires. If I see 100% thumbs up emojis, then I won't go into any definitions later on. But if I don't see some thumbs up, then that's okay. And I'll just kind of talk a little bit about what those screenings are. Okay, so I'm seeing a good bit of thumbs. That's a weird sentence. So especially when I can't see so many people. So um, okay, so for the ages and stages questionnaires that that Help Me Grow and its partners are completing, these developmental screenings have results associated with them. So a child may be considered to be on track in their development, they might need some monitoring, or they may be in need of additional supports based on the results of those screenings. So we track that. We also track information about their caregivers and also information about the child, so that if there are larger patterns showing up in our region, we want to make sure that children who are most in need of services are going to be able to access those. And lastly, we also use publicly available data, and we are consistently updating this dashboard to include more public data. So one of the things that we have right now that we're using is the Child Opportunity Index. And I'll actually advance to the next slide to talk a little bit more about that. So the Child Opportunity Index was created by Brandeis University, and it's an index of 29 different variables. So an index of neighborhood resources and conditions that help children to develop in a healthy way. And so this Child Opportunity Index, I'll show you as we look at the dashboard, has been a really great way for us to synthesize in one easy metric where children might be living, where they may not have access to as much opportunity. And we can pair that with ages and stages questionnaire results to see, okay, children in this area have less opportunity and it's actually seeming to impact their development. So what are things that we can do about that if that is the case? And then, as I mentioned briefly before about the ages and stages questionnaires that that are utilized by the Help Me Grow model and our partners, these are parent-completed screening tools. So the ASQ3, it's the third edition of the ages and stages questionnaire, and it assesses development in 5 different domains. And we'll look a little bit more in depth as we take a look at the dashboard in those different domains. For the social emotional questionnaire, that SE2, it's the second edition of that social emotional questionnaire. And it is, again, a parent completed screening that assesses development in children ages 0 to 6. So who can use this data? So far, folks who have decided to utilize this data, they've been pediatricians, superintendents, community-based organizations and advocates. Also, early childhood teachers and professionals, as well as caregivers, have used this data in the past. And I'll give some specific examples of how they've done that. So in looking at our data in aggregate that Help Me Grow has, folks have used it for grant applications as well as in their advocacy efforts to be able to say, I know that the children that I'm serving need additional resources and here's why. as well as for lesson planning. So folks have used some of this aggregate data to be able to say that, hey, the children in our area seem to be struggling more with communication than children in the rest of the region. So these are decisions that we've made in order to be able to make changes to our lesson plan to really incorporate communication skills for, excuse me, for example. Also, folks have used it for maybe budget and hiring decisions. So when looking at maybe just different areas of development that children in the region that they serve might need the most level of support in, maybe considering using some of that money to hire someone who's going to be specifically focusing on social emotional development, for example. So here's a couple of examples. So Help Me Grow Western New York partners with different Head Start locations throughout the region. And one of those locations identified what sites and classrooms that were a part of their network had children who are recommended for monitoring or intervention in areas of development more than in their other classrooms. And they were able to really start to split time between some of their staff who were there for additional support for the teachers to really focus on some of the classrooms where it seemed that children may have needed the most support for their development. Buffalo Public Schools is a partner of ours, and so they identified which universal pre-kindergarten sites that they were using that were completing these screening questionnaires, and they were able to determine when those UPK sites were doing the screenings in order to be able to deploy staff to help make sure that any follow-up that needed to happen, if a child was indicated for monitoring or intervention, was happening. And then for Niagara Falls City School District, they've used the data to see how they could get their school ready for children. So for example, taking a look at some of the needs of children who might be only 1 or 2 years old in the district, but might be coming into UPK in just a couple of years, being able to make decisions to say that it seems like 2-year-olds right now in our school district area are really struggling with X area of development. So we might want to make sure that we have the proper supports and lesson plans needed to support children in that way. So we've also utilized this data to kind of do higher level analyses. And so the data that we've been collecting since 2014, for example, showed us that in Erie County, children living in very low or low opportunity areas are 23% more likely to be recommended for intervention in nearly every ASQ3 domain. So those different 5 areas of development that we talked briefly about earlier, than children who are living in moderate to very high opportunity areas. So this is something we have really tangible evidence that in our region and in this county, having access to opportunities as a child can really change how you grow and develop. And so we're using data like this in order to be able to say to important decision makers that these are the reasons that we really want to invest in early childhood, because this has implications for how a child grows and develops throughout their life. Also, some of the data that we've been able to provide to Erie County, for example, we found that Erie County children who are 0 to 2 years old, so this is data from 2021 through this year, 2023, they tend to excel in gross motor, fine motor, and personal social skills, but seem to have more need for support in communication and problem solving. And so as Erie County is making decisions about how they might want to start to support children who are under the age of 3, making decisions that might really benefit their communication and problem solving skills could be beneficial. Also, we saw that 13% of children who were recommended for intervention in 13% of children in Erie County were recommended for intervention in 2 or more areas of development. We generally expected that only to be about 2 to 7% of children. So what that means is that children in Erie County who are struggling in one area of development tend to be struggling in another area of development. And so that we want to make sure that we're getting these screenings to children as soon as possible so that they can be supported in each area of development as needed. So lastly, how can this data be used? So we're going to use the Help Me Grow data dashboard in order to be able to answer a couple questions as if we were a pediatrician in Buffalo, New York, as if we were a childcare provider, and as if we were a CBO who's looking for maybe some grant application data. So I'm going to go ahead, and this data is publicly available at helpmegrowwesternnewyork.org. So this is our lovely website. And as you can see, right above this cutie over here, up in the top right corner, there is a link to the community dashboard. So full disclosure, this morning I was tinkering around with the dashboard because I wanted it to be absolutely perfect for this presentation today, and I broke 2 of the maps that are available to you on the public. However, they're all functioning for our demonstration today, and I've updated the maps, and so they'll be ready for your use probably in about a half an hour. But of course, high pressure, I just decided that I was going to change some things before we did this presentation, and that was a huge mistake. So if you ever need any type of proof to like just not mess with anything before you're about to do a presentation, I'm here to be that guy to tell you don't do it. Don't make the changes. So I'll go ahead and share my screen here to take a look at our dashboard. Is everybody able to see? Can I get a thumbs up that we're looking at the dashboard now? Sorry.
Yes, we're good.
Excellent. Just want to make sure. Thank you. So this is the homepage of our dashboard for Help Me Grow. It just really gives, as we look to answer some of these questions that we discussed earlier, I am just going to kind of take you through an overall general tour. If you have any questions as things come up, feel free to either use the raise hand feature, which is located where those emojis were earlier, or you're welcome to just unmute and shout it out. So you can see that the total number of children who've been screened in Western New York is about 19,000 children. So that's almost as many people who fit in Key Bank comfortably. So we're really proud of that. Our partners have been doing incredible work throughout the 8-county region, and this data has been since 2014. So almost 9 years of data that we have here. For total screenings, so as you can see, the total number of screenings is much more than the number of unique children screened, because it is our hope that children are receiving multiple screenings as they develop throughout their childhood. We give a little bit of information about the ages and stages questionnaire. And as you hover or click over some of these big I dots, as we look at the data, it will provide some just additional information about how to use the dashboard, or maybe what different variables mean. So I have like a little GIF here of just how you can interact with the dashboard in case for some reason your first time coming is not through one of these sessions where I'm showing folks how to use it. If you don't feel comfortable utilizing dashboards, this kind of just gives you a sense that you can hover over things to get more information. You can click, you can add filters in order to change what type of information that you're looking at that best fits your needs. Okay. So this page is about our developmental milestones. So as I mentioned before, the ages and stages questionnaire that relates to early childhood development is split up into 5 different domains. So over here on the right, you can see the 5 different domains. We've got communication, fine motor, gross motor, personal, social, and problem solving skills. If anyone wants to learn more information about those different domains, you can click here and it'll take you to the Ages and Stages website by Brooks Publishing in order to learn more about each area of development and what is actually defined in those areas of development. I also have like a big I here, because something that I think it's important to note is that every screening, right, is created and it's normed in a certain way. And the ages and stages questionnaire was normed with the sense that about 12% of children will likely be indicated for monitoring or intervention. And that's based on census level data about the number of children who might present with different developmental delays. And so the reason that I include this here, and the reason that we have these kind of little pink lines, dotted lines at the 12% mark, is that we want to give a marker for different folks who might be using the dashboard to get a sense that if something might be, if we have enough data to make determinations about what's going on in a certain group, we need some kind of number or reference point to say like, hey, is this number higher than normal? So has COVID really impacted the communication skills, for example, of young children? And so those types of dotted lines might be a nice way that we can show, okay, things seem to be a little bit different than what we expected them to be. So up here, you see all these different filters. So you can filter by age, by year, and those filters will change, these graphs here on the side, to show how children are developing in these different domains. So for example, if I were to click on Niagara County, for example, that's a filter. We can see that over 3,000, nearly 4,000 unique children have been screened in Niagara County since 2014 for over 6,000 screenings. And we can see to the right that the graphs change based on the fact that I clicked Niagara County. I'm also able to see, say, for example, I'm particularly interested in how less than 1 year, 1 year, and 2-year-olds are doing. So I can click these different filters. My map goes a little bit crazy every time I do that, but it comes back. So now we're looking at just the developmental needs and health of children who are under the age of 3, for example. So we might be able to see that children who are under 3 seem to be struggling a little bit more in communication than we would initially expect. And that could be a factor of the pandemic. The thing about this data is it's not necessarily going to tell you all of the underlying reasons why you're seeing the numbers that you're seeing, but the data is helpful to be able to show if you have a hunch about something that might be going on, you can see if these numbers support your hypothesis. So that's one way that we can kind of use this dashboard to get a sense of what's happening. Also, say, for example, we're curious just in general about how many screenings have been happening in a certain area or a certain county. So if I look at, Genesee County, for example, I have data for about 139 children and over 160 screenings or so. So that as we look at some of this data, we can also specifically look at either the age of the children, if we want to see if a child who identifies as female, they have different developmental needs in the county than maybe some of the children who identify as male. Some of those changes we can get from this dashboard. So for our social emotional data, this is for our ages and stages SE2 results. So let's say, for example, we want to do some of the same things. We're looking at, let's say we want to know particularly about the needs of in Chautauqua County. So we have nearly 900 unique children screened, and say we want to know about the developmental health of the male children in Chautauqua County. So we can see that the social emotional health of boys in Chautauqua County, we see a pretty significant difference. We're at about 24%. So about 24% of the boys who were screened in Chautauqua were identified for intervention. So that might be a statistic that someone who's working in Chautauqua County with young children might want to know and to be able to utilize to talk when they're making decisions about like different programming, lesson plans, or even grant applications, and to advocate for additional funding for the children that they support. Any questions about anything thus far? I'll take your silence as like stunned awe just to continue my presentation here. But no, thank you again. For any questions that you have, please feel free to put them in the chat or to ask right away. Also, like if you want to take screenshots of this after you apply certain filters in order to be able to see differences between like maybe your county and the region overall, that is something that you are able to do. In terms of exporting tables, unfortunately right now that is not a function that's available on this dashboard. Usually exporting tables is something that is available for the type of software that we have if you have like a username and login. So if you do have additional needs where you want to look at like row level data or something like that, that's obviously all been de-identified, then that's something that you can make requests to us about because we want to make sure that this data is being used by the folks who are providing direct services to children and families in a way that could help support them. So this page is a little hefty, so it takes a moment for the map to load. So we do have zip code level data for children throughout the region. So it can be very beneficial. So as we talked about, like those questions that we would want to use this data to answer. So let's say, for example, as a pediatrician, I want to know what are the developmental needs of children in the areas that we serve, and how does this compare to maybe the region? So let's say, for example, I am a pediatrician that's specifically serving in the Buffalo area. So I might click a specific zip code, for example. And it does take a little bit to load. Sorry, there's a lot of data that's included in this map, so it's a hefty map. All right, so as you can see, we've got a couple different zip codes in the Buffalo area selected. I'm just going to zoom out a little bit so that you can see what I'm looking at here. Okay. So if I were a pediatrician who's serving a couple different zip codes, so let's say I'm serving 14204, 212, 206, and 210. So working with a lot of kids who are in the East Side and South Buffalo, we see that the Child Opportunity Index indicates that these are areas of what they consider to be very low opportunity. So there's not a lot of opportunity for some of the children who are growing up in these areas as it relates to their 29 metrics that that are educational opportunity, health and environment opportunity, and social and economic opportunity. And we see that there might be some indicators that this could be impacting children in some areas of development. So we see that kiddos growing up in some of these zip codes might be more likely to be indicated for monitoring. So the highlighted region for kiddos in these zip codes, we see that about 14% of kiddos are identified for monitoring as compared to 12% for the rest of the region, for example. So these are the type of statistics that can be helpful when trying to advocate for additional services or additional funding for children that you may be serving. If you want to indicate that about normally and about the rest of the region, we see about 12% of children indicated for monitoring and intervention in social emotional health. But in these regions specifically, we're seeing an additional need for supports. Anytime that you're using a dashboard, you can usually click off of part of the map in order to be able to reset filters. And like I said, unfortunately, this page is a little slow just because there's such a significant amount of data that's associated with it. But hopefully it will load in just a second. So if anyone is interested in learning more about the Child Opportunity Index, it's a wealth of information. It's a really great source because they also have maps on their own website available with this type of data. Also, that's broken down by census tract. So I have an information bubble here about the Child Opportunity Index, and that if you click it, it'll take you to the website where you can learn a lot more about that index, why we chose it, and that score. You can also apply different filters to this map as well. So if you wanted to look specifically at areas, say you're an organization that really focuses on like the economic health in an area and how that impacts children, you could specifically look at areas that are considered to be very high in economic opportunity, maybe very low in economic opportunity, and how that type of opportunity specifically might be impacting a child's development. You can also look and see if there are major changes based on the age of a child who's screened and also the year that those screenings were completed. I will say that as our organization has worked to increase the number of children in rural areas that are being screened, we have been focusing a lot more on some of these different counties, Wyoming County, Allegheny County, Cattaraugus, Chautauqua, and we may not have at the zip code level enough data to be able to make a real determination about the needs of the children in that area. So if we hover over a certain zip code, so for example, in this zip code, we see that the number of screenings that we have is less than 10. So we may not want to make determinations about the needs of children in that area until we're able to get more data about what's going on. So we want to make sure the reason that we're kind of aggregating this data in the first place is to be able to say, you know, for an individual child who completes a screening, we want to make sure that once if they're identified for monitoring or intervention, they can get the services that they need. If they have areas of particular strengths, that we can celebrate those with that child and family. And then also, you know, those types of decisions about lesson plans and individual education plans can all be made based on those screenings and are very important. At an aggregate level, if we want to see that children in certain areas or certain regions all are presenting with some very specific or very similar developmental needs, we want to advocate for additional resources in those areas, which is why we're kind of collecting this data in the first place. So for example, like for the CBO, like the question that we talked about answering, does living in a low opportunity area in Western New York impact a child's social emotional development? And we just kind of answered that question by clicking on some of the zip codes in an area that's considered to be very low opportunity. We see that children in those areas are more likely to be recommended for monitoring and intervention. So a CBO might use data or information like that to better advocate for kiddos in that area. And lastly,
Emily,
yeah.
good news. We've got a question in the chat and an
Oh,
opportunity if you need like a sip of water or anything.
sure, sounds good.
So the question comes from Bridget Hurley from the Children's Agenda in Rochester, asking, are there similar dashboards in other communities around the state?
So there are some similar dashboards, I would say. I think that I'm a little new to the early childhood field, so I'm going to be totally honest here. I'm still learning about all of the amazing resources that are out there and available in the early childhood realm. The Data Diversity Kids website, which is the one who has this Child Opportunity Index data, is national and has a lot of information about New York State as a whole and different areas of New York. The different Help Me Grow affiliates in New York State. Right now we have our 4 affiliates and we're actually expanding into other areas of New York State. So some of those other affiliates do also have a dashboard as well. All of us are a little bit different in terms of how the Help Me Grow model is being implemented. So it may not look exactly like this, but they might have some similar data about what's going on in the region. But that's an excellent question. And I can certainly look to learn more about, for example, like Help Me Grow Finger Lakes, what they might have available. I believe also Cornell University has a really excellent dashboard just about the level of needs that families might have in terms of income and technology. And I'll be sure to add actually to the last slide of this presentation, a few links to Census Bureau maps and data, because the Census Bureau has actually gotten much better at the way in which they've shared data. It's kind of been like a not so kind of like an insider secret, I guess, that it's been very hard to access census data in a way that is easy to see and utilize. And they've done fantastic lately with making several different resources. So I'll actually, on the last page of this slide that we have to share with participants, I'll just add a few links to some of those census level data sources because they're wonderful. They have some about maternal health, for example, that like I don't have data about that linked to this dashboard, or like blood lead levels, which has been a big area that has impacted early childhood development in our region, for example, that we haven't yet implemented here.
Thank you, Emily. There's a couple, there's another question just about the Child Opportunity Index website in the chat.
Oh, sure. I'll take a look. Oh, yeah, I'm sorry. It's a kind of a weird name. It's datadiversitykids.org. Actually, it might be Diversity Data Kids. I'm sorry. One moment. I'm just going to do this while we're all here. It's diversitydatakids.org. My apologies. I'll type it here in the chat too.
Thanks, Emily. I think that's the questions for now. So feel free to, if you want to finish up, and then we can ask the
Yeah.
group if they have more questions or a little discussion.
Sure. So the very last thing that I'll show you is just our program overview. So folks who decide to partner with Help Me Grow Western New York, if they have a certain level of screenings, like a certain number of screenings, we do have this page for them on their program overview so that they're able to see how many screenings maybe they as an organization have completed. And for us as Help Me Grow, we're curious to see like where we might want to bolster where screenings are being done. So for example, right now, over 5,000 of the screenings that we have been completed by medical providers. That might be an area that we want to continue to do additional outreach to make sure that we are that medical providers in the Western New York region are completing early childhood screenings in a in a manner that's consistent with like APA, for example, and how we might be able to support them in doing that. And also just kind of working out any data sharing that might need to happen so we could also make sure that our picture is as complete as possible for what's going on in the region. So for example, if I take a look at like, Buffalo Public Schools specifically, they would be able to see that, for example, kiddos really seem to be struggling with fine motor skills. And so that might be an area that they want to provide additional support to kiddos in that area. So yeah. That is the Help Me Grow dashboard. So again, the way that you can access it is by going to hmgwny.org, so helpmegrowwesternnewyork.org, and by clicking this community dashboard feature. As I mentioned, I did break 2 of the map features right before we got on, but it is updating. So hopefully sometime in the next half an hour, both those map features will be working again for you, just like you saw here today in our presentation.
Great. Thanks so much, Emily, for the presentation and all of the information. That is just, you are the brains behind all of the dashboard. So we are just grateful for your expertise and all of the information that you shared. I know that was a lot, particularly as you read the temperature of everyone's fluency and comfort with data. I think that's a lot to process in the short amount of time that we have, but certainly really appreciate what you shared. So we've got a few minutes for some additional conversations, questions, comments, thoughts. There was one that came up in the chat from Carrie, just inquiring about Help Me Grow Western New York and our partnership and relationship with Strong Start Chautauqua, and just how we're coordinating across county lines in that way.
Yeah, thank you, Carrie. So I do know, so I am probably not as informed as like our outreach specialist in this area, but I will say that at least from a data perspective, almost all of the screening data that we have is from Strong Start Chautauqua. So I just know that, I guess, in terms of data perspective, it's from them. In terms of like the level at which our collaboration and things of that nature is happening. I also know that with our centralized access point, if we do receive a call from Chautauqua County, we actually work with Strong Starts to make sure that any follow-up that's happening is actually done through them, since they are so well connected in that county.
Great, thank you for the information.
Yeah, no problem. Thanks for the question.
Yes, Bridget Hurley from the Children's Agenda.
Hi, so I admit that I was not listening and taking notes in the very beginning. So Emily, I just want to make sure I understand. So you are on staff at Help Me Grow?
So I'm on staff at CCNY Inc. And then I work on the Help Me Grow project here. So yes, so kind of like both. Yeah.
Thank you.
Yeah, no problem.
And CCNY is the backbone organization for Help Me Grow Western New York. Emily's contact information, we will be sure to, it is on her slides, but we'll be sure to share up for any follow-up questions, or to share with members of your team who may be responsible for some research and data analysis. Emily is an awesome resource, and certainly I think would be a great person to connect with after today. Bridget, did you have anything additional?
Well, I do actually. I don't want to hog.
No, please go ahead. That's okay.
And it's also not exactly about data. So, happy, of course, to, not receive an answer, but I'm interested in what other folks on this Zoom feel about. So the Children's Agenda staffs the Kids Can't Wait Coalition, which is a statewide coalition seeking reform in EI and preschool special ed systems in New York State, and we have partners around the state. But my question is more around, I have heard both around the state and in national conversations, some ambivalence about how to use the data around the percentage of children who are screened. So, it's a victory. No, I'm sorry. Let me back up. Not how many are screened, but how many have been identified as, eligible for early intervention. And particularly around the racial disparities data, that, is it a good thing that when we're identifying more kids in need of services, I mean, or I guess maybe, is that an accurate indication of the need in the community, or is it an accurate indication of the screening programs that are in the community? So I'll just leave that there. And as I said, there's sort of a racial disparities aspect of that question as well. I'm just curious about other folks on the call, how you, or Emily, if you have a comment, just how an increase in the number of children eligible for EI is perceived, and how you use that information. Does that make sense? I didn't really think a lot before I started talking.
I think that's a really important thing for us to continually come back to as we're looking at this data. One of the reasons that Help Me Grow, for example, Western New York favors the ages and stages questionnaire is because it is parent completed, which helps kind of reduce some of the bias that maybe an individual who might be a teacher, educator, doctor, if they're not coming from the same community, would assess development in a child that's not from their same community, for example. So that's one of the ways that we think like a parent completed screening can help address some of those racial disparities in those identifications of needs. However, there are also that does open us up to another window of what are culturally different considerations for what's developmentally appropriate at different ages. So again, it's certainly not 100% foolproof, I guess. I don't really know if that's the right word that I want to use there, but it's something that we definitely need to consider as we're thinking about how these screenings are implemented, who's doing them, and then from there, are the services that, and I know, for example, the children's agenda has been fantastic at really just pointing out, once they're identified, are the services available even for the children to actually receive, and that's so key.
Thank you.
Thanks, Bridget. Did anyone else have a comment or response to Bridget's question? Emily, thank you for your thoughtful response. Others? I think it bears mentioning that in New York State ranks second to last in the nation in terms of completed developmental screenings. And so we see Help Me Grow and our partners, cross-sectoral partners, really this is a heavy lift for us. And so the idea is we really want to get as many children screened as possible, and certainly the earlier the better. I know Help Me Grow Western New York is uplifting the 3x3, 3 screenings by 3. To help to, have those early issues identified, or celebrating those milestones that are completed. And so we recognize that in our pursuit of getting more children screened, that there will, of course, be the accompanying more children screened, more children being identified and needing those services and supports, and recognizing that currently in the early childhood system, we are lacking and seeing an exodus of therapists and providers who could respond to some of those developmental delays and disabilities. So I think this is a really important conversation, and particularly we see that within our communities and families of color. So Bridget, thank you for raising that and recognizing that there is some real heavy lifting here. From both kind of institutional practice as well as from a public policy perspective.
Thanks, Rachel.
Other questions or comments for Emily? Yes, Mary Kay, nice to see you.
Hi, and Emily, I was having terrible technology issues today, so I feel your pain from early on, and hopefully I don't get knocked off in the middle of my question. But I was just wondering, the demographics you talked about early on your presentation, do you know how we compare to other communities as far as things like, what percentage of our children who are living in those higher risk areas, you know, how do we compare to other communities like ours, as far as the percentage that we're seeing screened who are behind in developmental or other development, you know, milestones or other developmental areas?
That's an excellent question. So to be honest, Mary, I don't. The short answer is I don't know. So I have the data for Western New York, so I'd really be able to compare maybe communities that might have similar like median incomes, for example, within the region, or maybe similar demographic backgrounds within the region. But unfortunately, I don't have that level of data for other parts of the country.
Now that we are, you know, we're expanding Help Me Grow in New York, maybe we can have an opportunity in the future to see how our community looks compared to some of the other communities, and at least in New York State. Thank you.
That's an excellent point. Thank you. Yeah.
And I think the nice thing about Help Me Grow and the support that we're receiving from New York State and from our partners in grant making and even county level partners in supporting Help Me Grow, there is that common connection that we all have. So we meet regularly to talk about what we're seeing regarding some of the developmental health and learning needs in our communities. We talk about our data, we talk about practices, sort of best practice, innovative approaches. And so that's a regular occurrence. And Emily has been a part of some of the data conversations with our partners in New York State and helping to lead those conversations and plannings about what would be most effective, what could we all use as kind of the common data sources and connections. Emily, I don't know if you want to talk about any of the New York State work of that you've been a part of.
Sure. So Help Me Grow New York State is so right now currently 4 affiliates, but we are expanding, which is very exciting. And we are working together to consider what metrics we all are currently collecting and could report out on that would be in a statewide dashboard. So we're in conversations to have something that would cover New York State, which is really exciting.
Thank you. Any other questions or comments?
I just want to, you know, thank you for this because it's exciting. It's an exciting time, and getting data is so important for us to be able to know where we should be putting our limited resources. And so thank you for presenting today. It's really going to set us up and position us to do better work if we have this data. And especially I'm so happy to hear that you're talking about New York State and you know, how you're all working together. That's great news.
Thanks,
Thank you,
Mary
Mary
Kay.
Kay.
All right. Well, I will encourage everyone to, you know, tomorrow's lunch, later on today, over the weekend, go cruise around the data dashboard. It is an exceptional resource when you really dig in and do those filters and see the various communities and zip codes and ages and all of the different ways that you can access and utilize the data. It's really incredible. And we've heard, you know, anecdotally from so many community partners across Western New York of how they're using this information. Emily talked a little bit about the ways in which, you know, the school districts are using it, from budgeting and forecasting and staffing, how childcare and Head Start are using it, and to inform lesson planning and curriculum design. It's just really, really, it's really cool. And if you're a data wonk, and even if you're not, it's just cool. So please take a look at it. And Emily will always be a resource for you. And we'll share the presentation, and we'll add a couple of details about some of the resources around like the digital equity and inclusion portal through Cornell, which is a great data resource. we'll talk about we'll share some links to the census data that Emily mentioned and a couple other resources that will be really helpful, I think, for you all. So Emily, before I share a couple quick announcements, anything else for the good of the cause?
No, woe is he who like takes the lunch meeting long. So I just say thank you all again for your time. Really appreciate it. If you have any questions or concerns, my email will be in the slides that we sent out. And I will just add a few of those data resources that I found to be super helpful because it's really cool what's out there. And I just happen to have the position and time and energy that gets to look for all these fun things. So I'll add some quick links. So thank you all again for your time.
Great, thanks, Emily. So with that, I will say that you have the opportunity to attend our final part 3 summer learning series segment coming up in August, in mid-August. Thrilled to share that we have Jeff Smink from EdTrust New York and representing Raising New York to talk about early literacy and a recent report that EdTrust published with some great recommendations for action and some policy change opportunities as we consider looking forward to the next New York State budget and legislative year. So we will be sure to send that out and make sure that you have it. And thank you to Amy for dropping that in the chat. So please check it out. And if you missed our first summer learning series with Bridget Walsh from the Schuyler Center, that is available on our website, Liftoff, WNY.org. And you can go check out our first session that focused on oral health, early childhood oral health, with some great resources, information, and opportunities to learn more. So with that, I want to thank you, Emily Oakes, for your awesomeness and your expertise. And thank you all for joining us today. It was wonderful to see all of you. Hope you have a great rest of your day and a good rest of July, and we'll see you in August. So thanks so much. Talk to you soon.